New videos every day.
Hello again, this is Athena Jezik, and we're going to just show a little bit of self-help, particularly with the forearms. You know, so many of us work at the computer so much during the day. We spend a lot of time with this little movement in our fingers, and it tightens up the muscles, and it gets sore, and things begin to occur, and then we have other problems that could occur, such as carpal tunnel or stiffness or arthritic conditions. So I'm just going to show you a few little things that can be done, either doing it with your partners or with the coworkers that are open to this sort of thing, or even on yourself to help to relieve some of the muscular tension that happens in the forearm. Okay, the forearm we're going to deal with from the elbow down to the wrist and into the hand, a little bit into the hand, but primarily the forearm muscles. So there's two bones that move back and forth, so it's just nice to see how the range of motion is, just moving this back and forth. And this is if you're working with your, I guess it's called a cubicle buddy, or somebody in the next cubicle. I don't really know that world, so I have room to learn out of there. And articulating and just checking range of motion in all the joints, including in the fingers. Just wiggling them around and checking the tension that might be there that's holding these things in place. Shaking them around a little bit. And of course, if you're working on yourself, then you can just kind of check it yourself and do the range of motion yourself and feel it around. Okay, and then if you want, you can put some lotion on, which is a little bit better to do than without, because there's a lot of friction that occurs. So we'll put a little bit of lotion on. This is a blend of coconut oil and a few other things. So then you just run your thumb from the wrist, and you can feel very distinctly the muscles. It's a softer tissue. And as you run up, you might feel things as though you're having those little packing bubbles inside your arm. That's little knots, little toxic buildup, and things that will create pain and discomfort in the muscle as time goes on. So just run that thumb up, and don't go too hard over the bone. You don't want to rub with a lot of force over the bone. Make sure there's some kind of the meaty part above the bone that you're feeling, sensing. And just start by doing that. And then doing some cross fiber friction. It's a little tricky to see, but you run your thumb across there. But again, you don't use a lot of pressure. You're not stretching and hurting the skin. It's deep enough to feel something, but not so deep that it's being invasive. It's just what the body is allowing. It's not forcing any further in. The body actually likes to have some choice too in the matter. And you can do a little petrissage, a little kind of lifting the muscle up and getting underneath it, and circular like that. So we'll run the fingers, the thumb, up the forearm, and feel that separation. And then you can take your thumb and go across in a cross fiber direction, which will help to relax the muscle out a little bit more. And then when you take your thumb back up in a thumb iron, back up, you'll notice that if there's packing peanut sensations in there, that you'll feel that they're dissipating because they're moving out of the muscle. It's just toxic buildup. It's things that are trapped in the tissues, and it's good to have that out of there. You want your muscle to be very supple. You don't want it to be full of a lot of toxin or knots or things like that. Okay. And then with carpal tunnel, we're dealing with a lot of issue right in the wrist and the palm of the hand, the very deep part of the palm of the hand. So to keep that in as good of working function is to give a little traction to it, just by pulling the hand out and separating the wrist bones. There's quite a few carpal bones or wrist bones, and they don't have a very big blood supply to them. So the healing process in that area can be quite slow, particularly if there's a break or something like that. But even with tension, because it doesn't have good blood flow, there is lymphatic flow in it, but it's not as good as some parts of the body. So we want to take the time to give a little decompression into those bones, so that whatever space is there, that the fluids can begin to move well in there. And the fingers, same thing, the fingers can be pulled a little bit. You don't want to go with a lot of force. Again, if you've watched the other videos, you want to go into it with that type of resistance and just lead it through, respecting that resistance that it's giving. Don't force anything. The work that I teach is never forceful. And also giving some stretching to the fingertips this direction, holding them down and just feeling that fingers going up. You can rotate them a little bit or glide them back and forth. You can also take them in circles, which is a rotation. And the thumb, of course, the same thing. You want to make sure that that's working well. And then you can also grab a hold in this direction here very gently, and on the other side of the wrist, and just pull slightly open this way. That's another way. When you do that though, we can drain the joint lymphatically by just taking the hand and just turning it back and forth just slightly, so that the wrist is moving, but there's a stabilization of the forearm, so those bones aren't following with the carpal bones. And just have a little bit of motion there. You can have it go up and down, take it into all the range of the motion possible. And then also you can come up to the elbow and do the same type of thing where you're holding on to the arm, the forearm and the upper arm, and giving a little bit of traction where you're stretching it just a little bit, giving some space into that joint, and then rotating the bottom arm, the forearm. Whenever you do this on a joint, it's the most distal part that's going to be moved. The other part is going to be stable. So whether you're working the knee or the elbow, it's going to be the part that's most distal or farthest away from the mid part of the body. And you just rotate that a little bit, and you can take that into a bending and stretching as well, because all of the attachments of the forearm come up right into this area at some location. Usually it crosses the joint. And then check again, and what you probably find is that the muscle is much more supple, much more movable, and probably feels a lot better. So that is one way that you can just take care of your cubicle buddies and other people that might be around you that spend a lot of time on the computer. And you can take care of each other's hands and arms that way, and maybe we can not have so much carpal tunnel. So please go to the rate box and click your rating on this video. Please also join the channel and get all the most recent updates. And send a comment, because we will get to the comments. I do read the comments, and I appreciate hearing what you all have to say.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psychetruth channel.